Hi, my name is Pavindra Tiliza. As part of MN 501 Network Management in Organizations, I'm presenting this presentation on two peer-reviewed publications on ethical issues related to the technologies on the workplaces in the healthcare sector. Mm, So I got two peer-reviewed publications, ethical issues among healthcare workers using electronic medical records, or systematic review by Saira Abjar and Amber Arsad, and second article is publication two, that's a ethical issue related to e-health, and integrative review by Anuja Kinen, Mina Stolt, and Rita Sohanan. So first article is in the conclusion of 24 articles um, taken from the Google Scholar, PubMed, Medline, and ParkMedinet um, on the ethical issues faced by healthcare workers using EMR. And this review found most of the issues was around privacy, then autonomy, then sequentially confidentiality, justice, beneficence. Um, as you can see in this slide, privacy got 20 articles, it has 83%, and autonomy, the second one is 15 articles, that's 63%. So main points of this research was privacy. Privacy was about data breach, unauthorized access, and confidential information disclosure. Privacy protection was lacking in emerging technology like mobile health, because of lack of protection policy, and healthcare workers also um, not following the policies about sharing the information, uh, patient information with the college and other patient. And in the name of research, the informations were shared or unauthorized access were granted to healthcare workers and other organizations that breaches the confidentiality. And other point is beneficence and non-malfeasance. That's doing good for the best the best of the uh, patient's best. And another one is justice. The justice is should be equal um, equally providing service to all the people, regardless of their age, ethnicity, and gender, and economic class. But due to the lack of internet knowledge, and the justice to provide EMR was not equally shared. Healthcare workers sometimes provide limited service quality to uh, uh, un, unbiased and similar pattern. And another point is autonomy. Autonomy is the decision of the patients to make their choice about their use of their records, and because the digital records are vulnerable to um, vulnerable and and that data can be this confidential information like socioeconomic, several health issues. Patient information can be leaked, um, and people are willing to follow the uh, um, willing to share the information, um, but if the policies uh, healthcare is followed around the disclosure, consent, and willingness of patients. Research even found in some countries autonomy consent were not taken from the patient about handling of the records. Another issue, another point was fidelity um, and in this one, sometime the healthcare workers were um, doing data was exposed due to the fault by healthcare workers or sometimes by intentionally with the intention of stealing. Another point was veracity. Healthcare workers, there was lack of communication skill or delivering art of delivering the bad news to the patients and families, and, and unnecessary the news was bad news about the patients was shared with the healthcare workers or the healthcare workers. Another article is the second article is the conclusion of 26 article from different resources, different database resources like Scopus, Sinahal, Web Science, and it was published in US, UK, Canada, Australia, Greece, China, Germany, Netherlands, and Switzerland. The article and the article publication based on four themes: privacy, justice, patience, and non-maleficence and trust. And these four themes were subdivided into 11 subthemes that concerns e-health services, ethical issues around healthcare and social care. The first theme is privacy in e-health. Privacy was divided in four themes called data sharing, ownership, information consent, and access to data and safety. Data was data was shared openly among persons during research and between healthcare workers, despite concern by almost all citizens about their sharing of their data. Data security was one of the major questions around e-health services, particularly on data migration from analog services to e-health services. People also expressed their wish that their information should not be provided to the third parties. And some individuals want to only share their data if information consent is given. Another theme is trust in e-health, and then this trust theme was subdivided into accuracy, legitimacy, and processing of data. Competence of healthcare professionals and safety and response of security. Patients concerned on incorrect information, poor data, and sharing of data between different organization and complexity and different systems. Complexity of different systems, information security is one of the main concerns on citizens and need correctly protecting data stored data and storage it as per store it as per agreed standards and rules. Another is justice in teams. This, the, this team was subdivided into quality, equality, and equity, avoidance of inequality. The e-health services were could not be used by all the people because lack of internet in some community, poor skills and system use, education barrier, and difficult to understand the e-health system. Especially older people, experience complexity to use e-health services, while some opted for totally avoid using the system. People fear of unfair treatment, stigmatization, and something wrong doing by somebody. And another theme is beneficence and non-maleficence in e-health. This team was subcategorized into protection, advocacy, and defense of rights. Citizens mostly worry about the data leak on their sensitive data like mental health, drug use, sexually transmitted diseases may lead to discrimination, career harm, social reputation damage, or stigma. And these people fear sensitive data sharing, like use of intoxication, may lead to receive lower level of care if there is no advocacy on their interest. Data leak, error in data transfer, and mix up the identities may cause in in danger of patient care. And this is the reference. Thank you.